This is Dr. Liz Geriatrics.
That is a tough one. And then I read an article of, what to do when your parent is stubborn. And it's important to be able to distinguish. And actually, I went to a support group for social workers, and they were saying, Mrs. Smith, we wrote down that we had an agreement that she was going to take her pills and she was going to do this and this, and she just doesn't do it. She just won't do it. And I think if someone's starting to act kind of more erratic, or their personality is changing and they're not taking care of things the way they used to, I think it's really important that you find that doctor that can help you. Maybe not just the GP in town or the one who's taken care of them for 20 or 30 years. Mm-hmm. Maybe, go to a medical center where they have geriatricians, that we look at the whole elder person, the medications they're taking. And one of the first things I do is find out for that elder what makes life worth living. And if being really independent is the first primary goal, then we work to support that. But given that, we have to figure out, well, does this person have brain function enough to make these choices? Or are they starting to have early dementia? And everyone can identify dementia if someone's kind of sitting in the corner and kind of not knowing where they are or anything. But a lot of times they can tell you where they are, what's going on, but then 5 minutes later they'll forget and accuse you of hiding things because they were afraid something was taken and they hide it themselves, or that they get more angry than they mean to, or they're much more irrational. And when that happens, we've got to change our plan. I'm a geriatrician. I take care of particularly elders with challenging medical pain situations, too many specialists, too many doctors, and difficult behaviors.
Hey, give the next video a watch, and don't forget to click like and subscribe.